So, Mum, what's sickle cell?
Sickle cell is a genetic disease, which means you're born with it, and you get it from your parents. And it's a blood disorder in the first instance, and it means it's called sickle cell because it means your cells, which are normally disc-shaped, are in the form of sickle, so it's slightly more elongated, but it means it doesn't flow through your blood vessels as easily as possible, and it causes great pain episodes, which are called crises. And as I said, it's non-curable, but it can be managed very well with medication, and so there are better outcomes these days. It is eventually life-shortening, but people are living longer. Before, it was rare for people to live into their 20s, but now I know a few people in their 80s even. So the first point at which I knew or became aware of that I had sickle cell was when I was about 6 years old. Obviously, it's a genetic disease and you're born with it. So even if I may have suffered pain episodes before 6, it wasn't in my memory. But I do remember distinctly when I was about 6 having a pain episode. And the pain was so bad, I was crying a lot. Our carer kept trying to stop me crying, even though she'd called Mum from work and all of that. And in between her getting home, she kept trying to stop me crying. And the next thing I knew, I had been admitted into hospital. And I don't remember the full pain of it, but I do remember the fuss everybody made of me while I was in hospital. Lots of Mum's friends came to visit, and I was obviously in the children's ward, but I had lots of visitors. The part of my life where I had it so many times, such a lot, was in secondary school. I used to have to be exempt from things like excessive sports, strenuous housework, from the dorm, in the dorm. But also, as you know, children can be cruel. So I would get the other end of the stick where they gave me a nickname, and if you translate it, it means tomorrow you die. So you got both ends of the stick.
And you've touched a lot on like the physical side of it, there's a lot that's gone on there. And I know from our conversations about it over the years, you've talked about particularly just how impactful, but also how strong it's made you. But I just want to go back to what you spoke about when you were talking about your childhood and like the kids used to call you names. Just on that, like how did that sort of make you feel in the moment as a child? Like, Did you get treated any differently? Did you maybe look at the other kids in envy because they were doing some of the things that you wish you could do that's maybe considered a normal part of childhood? I
was very envious of not being able to participate in sports, because then I couldn't go into college sports and all of that. I used to try to do the things that didn't require a lot of running, like the high jump, and luckily I had long legs too. And so that helped me. What they didn't realize was the long limbs are a characteristic of people with sickle cell, inordinately long limbs, and shorter bodies. So that helped me, and I could do at least the high jump, but I couldn't do much else. So mentally, I suppose how it affected me was I tried to overcompensate, to hide the fact that I had it. I didn't like talking about it. I wouldn't tell people I had it unless I had a crisis and they saw. So those were some of the ways it affected me in my younger life. Luckily, in my early 20s and into my 30s, and well after I'd had you, there were long periods when I didn't have a crisis and I just got on with life. So in those times I was fine. You didn't know how bad sickle cell was until you were about, 17, 18?
I think so.
Yeah, and I had this major crisis in 2012, and that was the first time you'd seen me that ill. And when you came down from uni to see me in hospital, I was so spaced out with the medication. I remember you saying to me, "Mum, you're high."
And it was crazy time.
Yeah, I know it freaked you out. I do remember that. So yeah, that was. But since 2012, as I've been obviously older, I haven't been well at all, and it's been a downward slide since 2012, and now I have to be on dialysis because of kidney failure, which is a direct result of having the sickle cell. So now the complications are coming to the fore, but still we're trying to do what we do, which is enjoy each day that you're well, and try not to focus mentally too much on how hard it can be. And it can be hard, it has it takes a heavy mental toll. You have to literally bring yourself into a good place.
Yeah. I think that moment in 2012, when like you I remember exactly where I was. You texted me that you'd been admitted to hospital, you're having a crisis, and it just hit me like a brick. Like I think just that whole week or so when you were in the hospital, it was generally the first time in my life where I was genuinely scared that I might lose you. And because I think you came out once, then you went back in, and then I just started receiving messages from my Abana, my dad, and just about how unwell you are. So it was really tough. I mean, for me alone, emotionally and mentally, it was seriously tough. And having to go in with that mindset at uni, like I just couldn't cope. But I can only imagine how that must have been for you in that moment.
Yeah.
Like mentally, what did that do to you, and what has sickle cell done to you, sort of mentally in terms of your mood?
Yeah, I'm a very sociable person, as you know, and you sometimes tell me that I don't behave like a typical mum, that I can be silly, and I think I do that deliberately because I want to be silly. I want to enjoy things. I want to laugh. You know how I like to laugh. I can fall out of a chair laughing and that. So when I'm well, I try to enjoy the time that I have to be well. Because when you are ill, it is so hard. I mean, the pain and the zone into which you go. But at the same time, I haven't regretted my life in the sense that I don't know anything else. So I can't want anything else if I don't know anything else. I never thought, why me? Because if it's not me, it's going to be somebody else. So I didn't even think, why me? I just was like, you have to get well as soon as possible so that you can go with your friends to, wherever they might be going.
One of the things I've always sort of longed for and thought should be a compulsory part is that every sickle cell patient it should be mandatory that they have access to a psychologist or a therapist or a mental health professional.
Well,
can you just tell me, like, from what you've seen, has that been the case with you, or do you think maybe there's definitely room for improvement in that area as well?
I think you're right that there could be a case for making sure that as part of the treatment while they're in hospital, that they do talk to clinical psychologists about how they're feeling mentally, because all of them lie down very withdrawn and sad and overburdened by the pain. And it's true, and it's beneficial because, as you know, I was recently referred by my consultant hematologist to the clinical psychologist team. In giving her feedback at the end of it, I said to her that I had really benefited from it because all of a sudden my shoulders are less tense. I must have been carrying some burden that we've talked through and she's given me coping mechanisms for, because I'm now more relaxed in my shoulder. Because you have so much pain, you kind of brace yourself against the world, and you are like this all the time, and that can hurt your shoulders. So my shoulders are a bit more relaxed. I'm a bit more relaxed about how I breathe and use the coping mechanisms she gave me, and reassuring me that some of the thoughts I have are normal. For instance, I can worry about, I live in fear of the next pain episode I might have because I know how bad it is. But she's helped me cope with not dwelling so much on what I will do if I next have it, but rather focusing on making sure that I don't have one.
So the final thing I'd ask from this point is your message that you maybe you'd want to leave to other patients who are also in your situation struggling with sickle cell disease.
Yeah.
What advice, resources and support would you recommend for them to help manage not just their physical health but their mental health especially?
I will say that from the way I've been talking, you might think that there wasn't a sickle cell society. There is. As a sickle cell patient, I have joined a sickle cell group from Guy's Hospital. We meet every Thursday. During lockdown, it's all been by Zoom, but some of them have been in person. So join with other sufferers, because just talking about it with others relieves the stress on you. They also can give you tips on coping, some of the tips on coping. They can also laugh with you about some of the reactions that people, or the answers you get from people, or some of the stories we can tell when we've been in hospital. You can laugh now. It wasn't funny at the time, but we can laugh about it. But more importantly, if you have a voice, you can use it, and your voice is best when there's more than one of you sort of railing quietly in the corner. We're at the stage where this is the generation that has to fight for the recognition so that future generations can be treated more equally